Hello, welcome to Stress and Distress in Dementia webinar series. This series was developed by the Older Adults Psychology Department in Grampian. This module will cover how to complete an ABC chart and provide some useful examples to use within practice. So here we will look at how to complete an ABC chart. So here we have a hypothetical case of Jim, where we identified his name, date of birth, Kai, and perhaps the ward that he is on. And this is initially what you see in the first part of an ABC chart. It asks for the distress behavior, the date, time, where the distress was observed, and who was there at the time. So the first rule of an ABC chart is to be specific about what it is you want to assess. So for example, assessing aggression is just not specific enough, because aggression can manifest itself into many different behaviors. So you really need to ask yourself how you know the person is agitated. It should be specific, for example, such as pushing, or shouting for help, or stripping off clothes. This can all be discussed with the lead for approach and documented on at least 15 sheets of ABC charts. The second rule is that you should complete them consistently, so if you start the process, you should complete them every time the distress behavior is displayed. You need to record all sections of the ABC chart. If any of them are missed in the chart, it's not going to be as helpful. So for example, the date and the time are very, very important to record. This can give us a clue about whether the person tends to become distressed at any particular time of the day. And sometimes patterns can emerge. For example, when a sedative is given or a painkiller medication is wearing off or has just been given to the patient. If the behavior occurs before lunchtime, this could indicate hunger. And does it occur on a Sunday when family members visit, or perhaps overstimulate the person? This is also very similar for identifying where the distress was observed. Just to identify whether there are any reoccurring themes or potential triggers that distress the person. And then identifying who was there at the time is very important for allowing us to gather all of the right information and perhaps different perspectives on the distress behavior and what was witnessed. So here, this is the first part, which is the antecedent. So it's considering what was going on to the person prior to becoming distressed. So antecedents can trigger or reinforce the stress, so identifying them helps us to identify the cause of the stress so that preventative action can be taken in the future. So we can consider some environmental factors such as noise levels, any unusual incidents over the last 12 hours, for example, if there were any fire alarms or testing of buzzers going on, if there's been any temperature, lighting, or staffing changes, or maybe different staff communications, or lack of activity or entertainment, or maybe too much overstimulation, any other patients around the person that might be contributing to the person's distress. So here we have an example of filling out that part of the ABC chart. It states, Jim was sitting in the day room with Martha S., Joe R., and Betty. Betty and Martha were talking in the corner about Martha's skirt whilst Jim was shouting for help. Alice, the care worker, began assisting Joe with his snack, sat down beside Jim and held his hand. She stroked his hand and was telling him about her trip to France at the end of May to see her sister. So here we identify the location prior to the incident, which was in the day room. This might be quite helpful to identify, because if we look at maybe other potential ABC charts where the same distress behavior was presented, it might be in the same location, it might not. It's just a very useful kind of clue to include. Again, we have other people that were present. Perhaps there might be people that can contribute to the stress. The caregivers, that's very important, because we can also gauge their perspective and gather really useful and important information about them, and also gauge an insight maybe into the relationship, whether they're more reassuring or maybe they're also contributing to the distress. We also have the staff communications and interactions. So we identified what was being said, what was being done, and can use that to really gauge an idea of the behavior or what was going on prior to the distress behavior. The second part of what you will see is the behavior. So what did you observe the person do? This is simply a description of the behavior or behaviors witnessed by yourself, staff, caterers, or anyone that was involved or around when the behavior occurred. You should not interpret the behavior, just provide factual details as to where the person was, what they said or did, and to whom, etc. So you're identifying what actually happened, what did you directly observe, and also what might be useful is identifying how long the behavior lasted. So here we have an example. Jim looked at Alice and smiled. He mumbled something as if he was trying to have a conversation. Alice had to attend another resident and Jim started continuously shouting for help again. This lasted intermittently for a number of minutes, where he kept on looking around the day room for approximately 5 to 10 minutes until Alice returned to assist him again. So here we identify what was happening. So there was an interaction with a caterer. He was smiling, he was trying to he was mumbling, trying to have a conversation, and again we have the behavior identified. So we previously identified that shouting for help is something that we really wanted to observe. So Alice, the care worker, had left, and then Jim was presenting the behavior of shouting for help again. And then we have a rough idea of how long the behavior occurred. We can compare that with other ABC charts to see if there's any kind of reoccurring themes about where the behavior occurs, what happens, and how long it usually lasts for. And in the next part, we have a part of the ABC chart asking for the consequences. So what made the situation better or perhaps worse? These are the responses or outcomes to the distress behavior, either from others or to the person in distress. This helps us to determine what might be achieved by communicating their distress. So for example, in many instances, ABC charting can highlight the things that have been successful in dealing with distress, and these can be incorporated into a person-centered care plan. So what things to consider is how the incident was addressed, did it work well or not, and quoting what was said to the patient, including what helped and what didn't, and writing what was actually done will give us a rough idea of any approaches that are effective in lowering the stress, or maybe perhaps approaches that we should kind of stay away from that might exacerbate the stress. We should also identify specifically how the patient was comforted or reassured. So if it is successful, it could be repeated in the future. This gives us a rough idea of any effective strategies that can be used to lower the stress. So for example, here we have Alice had to attend another resident and Jim began shouting for help. After a few minutes, Alice returned and reassured Jim that she was there to help and apologized for having to quickly help another resident. Jim stopped shouting and allowed Alice to assist him with a snack. He appeared more settled and the shouting stopped. So here we identified what made the situation worse. Alice, the care worker, had to leave, and that's when it seems that Jim began to shout for help again. And we also identified when the behavior stopped, what was effective in lowering the distress. So here we identified that the care worker reassured Jim that she was there for him. She apologized to him and immediately kind of stopped shouting and allowed her to assist him with a snack. It also says that he appeared more settled, and then again the distress behavior stopped in that moment. So in the next part of the ABC chart, you will be asked to record what the person said during the incident. And this is pretty self-explanatory. You have to directly quote what the person said during the incident. It's very important because they can provide very useful cues as to what they're feeling, what altered reality they're in. So we can use that for analysis to identify any needs, any triggers. If the person is non-verbal and can only communicate through non-verbal communication, you can also record their behaviors through that. So for example, if they avoided eye contact, if they were making any noises for like growling or making clicking noises, that's very often what we see in people that are nonverbal. Please include that because they can all be very useful identifiers of the stress behavior. So here, for example, we have that Jim's communication difficulties mean that we are unable to understand anything other than yes or no or help answers at times. So in this situation, when Alice went away to help another resident, Jim continuously shouted for help, looking around the day room. So here we mentioned that Jim is experiencing communication difficulties and might just be very limited to what he can communicate with others. So it's very short yes, no, or help answers. He's not able to elaborate on what his needs are and what he wants, what he's feeling at that time. And then we also have a mention on, in addition to shouting for help, which is the direct quote of the patient, we also have a mention of nonverbal communication. So here in this instance, Jim was looking around the day room. Perhaps this could be for someone or something. This is very useful for functional analysis because maybe we can identify why he was looking around the day room, what was going on, what was his specific need in that moment. So really recording what the person says, and if they're unable to, what the nonverbal communication was being used in that moment to truly identify any important aspects to the behavior that's being presented. In this part of the ABC chart, you're asked to identify any emotions that were expressed before and during the incident. This is to identify perhaps any emotions or any needs that were not being met prior, leading to the exacerbated distress and the emotions that were felt during the incident. So for example, if the person was quite bored, a bit restless, that might kind of help us to identify the need for activity. And then they might, if they don't have that activity, they might become irritable or a little bit frustrated with having nothing to do. So here we have an example of a patient feeling content and afterwards feeling quite anxious and frustrated. So these might be an important chunk to identify any potential triggers or any needs that are not being met prior to the incident that might kind of lead to that distress behavior. Again, feeling restless and worried might be something that is felt during the incident. All very helpful cues to identify the cause of the stress. Important to write who completed the ABC chart, just as a precaution. If there's any information that we require, that's the person that would probably know the best about the incident and the date of the incident. So sometimes when you're asked to do ABC charts, you might notice that the behavior occurs more frequently. For example, maybe 2 or 3 times a day, so you're left with writing a lot of ABC charts, and given the time frame that you're given, sometimes we might be expecting more than 15 charts that we'd originally asked for, and that might be a bit more difficult because it's more time consuming, and not only for staff but also for functional analysis. So in that instance, we might ask you to complete a frequency chart. And the frequency chart looks like this, where you're asked to put a tally mark in the appropriate box in the presenting stress and distress behavior. It displays a list of days within the week and different times. So here we identified our case for Jim, and then the behavior that we are trying to observe was shouting for help. So here we would ask staff to tally any time that Jim was shouting for help. So for example, if on Monday at 9 a.m. he shouted for help, you would do a little tally mark then. And then over the week, you would carry on doing that every time the behavior was observed. And you should end up with kind of various different times of day that you observe the behavior. And here that's very useful because we can identify perhaps whether there's a specific time of day that the person is feeling distressed. So here we can see that between 1 and 5 p.m. there seems to be a little bit more shouting for help for Jim. So there might be something there that is causing him to be distressed, and that is very useful for functional analysis. We might be able to look at any needs that are not being met, maybe the environment, what's going on at that specific time, to truly identify any potential triggers or causes of distress. Again, this is very useful because this is obviously a lot more than 15 ABC charts, so having that is less time consuming and can provide probably a more important and key image and knowledge of the behavior. There is also times where you might ask, for example, to do 15 ABC charts, and once they are done you would move on to frequency charts, but that is very case dependent, so it really depends, but you will always be notified by the person doing the functional analysis and in charge of the case, so you're not really left alone with that support and knowledge. It'll always be communicated and clearly outlined what we are asking for. So just to summarize, here are some important things to remember. Anyone who observed a specific behavior can complete an ABC chart. It doesn't have to just be carers, it can be family, friends, just anyone who observed the behavior or the situation. It's just very important to make sure that whoever is completing the ABC chart has the right support and knowledge on how to complete one, and if they've never filled out an ABC chart, maybe the right support should be provided. For example, a carer sitting down with a family member and filling them out together. You should complete the ABC chart immediately following the observation of the specific behavior, and take at least 5 minutes to sit down and consider what just happened. This is really to identify what the important aspects of what happened, and ensuring that you're not leaving it too long so your memory may lose an important bit of information to piece the situation together. You should do them immediately so it's all fresh in your mind and you can identify any important aspects, and ensure that you're not forgetting anything that happened. If there was more than one member of staff present, do the ABC chart together, just so you can kind of bounce off what happened. Perhaps one person can identify one bit of information that the other person did not see. You might have different perceptions and different bits of information that you can put together to really identify any triggers or anything that worked, what didn't work. What's also helpful is printing out the ABC charts before. So say you identify one behavior that you really want to observe, so in this case it was shouting, you could put that into a Word document identifying the behavior already and printing out 15 ABC charts, and then staff can just fill out when that behavior observed, just so you don't get a mix of different behaviors and solely the one behavior that we want to observe for functional analysis. And just remember that ABC charts are just important as other tasks. They really are a key aspect of identifying any important factors or any triggers or actions that exacerbate the stress or maybe help ease the stress. So they're extremely vital for identifying that and hopefully implementing an action plan based on all of the information that we've gathered to lower the stress in the patient. Thank you. Please move on to the next video.